Welcome to another very exciting episode of TeqTalk, where we discuss tech, data, AI, innovations across all the industries. Today's episode is going to be amazing because we are diving deep into one of the very, very interesting topics. We will be talking more on some of the trends and future of home health care, especially inclined towards non-medical space. And joining me today is a leader who is the COO, Chief Operating Officer at Herewith, Veronica. Hello, Veronica. Nice to have you on the show.
Thank you for having me, Jas. I appreciate that.
Absolutely. Before we start, I would like to know more about you and the mission of Herewith.
I think that Herewith and myself have quite a unique background, both from the way in which we became to what we are and how we merged into a good partnership, I would say. I started out my career a long time ago actually as an NA. And that was back before, I don't know when CNAs, which are certified nursing assistants, were actually a thing. But a long time ago, you could be a nursing assistant. And I was 14 or 15 years old and started out in that geriatric space, caring for residents in facilities and really being on that one-on-one care.
Mm-hmm.
Fast forward, I now I'm a doctoral candidate, have essentially built my career off of hard work, being patient, and sometimes that's not the easiest thing to do, and really looking at those leaders before me.
Mm-hmm.
What I can learn from them is very strong, especially as a woman in not only healthcare, but technology.
Yeah.
It's such a unique space to be in.
It is very unique.
Yes, yeah, it is. And so I think that is, one of the things that's helped propel me forward is really being of an open mind.
Mm-hmm.
And learning from women like you who are in the space and never thinking that you know it all, and learning from male partners also who open doors for us.
Yeah.
And I think that's very important.
That's very impressive.
Yeah.
Let's move on to our the second question, which is like the mission of Herewith.
Sure.
So tell me a little bit more about what Herewith is and what is the ultimate goal of Herewith?
So Herewith is it's a technology also. It is the perfect merge of convenience, reliability, and accessibility.
Mm-hmm.
Some of the things that, as we know, a lot of caregiving role of our family members,
Right.
both the older and the younger,
Mm-hmm.
fall upon our shoulders.
Mm-hmm.
Most employees have the third shift. They go to work and they work, and then they maybe work a second job, and then they go home and they work that third job.
Mm-hmm.
Herewith has really wanted to come into this space and grant accessibility simply from an app on your phone,
Mm-hmm.
from the web page on your computer,
Mm-hmm.
so that you can have care for your elderly loved one at the touch of a finger.
Wow, that's so nice.
Mm-hmm.
Very touching as well.
Herewith is unique in a way that it's innovative. It's got ease and of use for everyone. But I think that one of the most important things is that we're not inhibited by any zip codes or county lines or territorial spaces. We can be anywhere that a customer has a need.
Mm-hmm.
And I think that is very ingenuitive. There's not a large overhead fee for the customer on either end, whether that be adult child that is looking for care for their partner or for their loved one.
Mm-hmm.
And there's not a huge, wait for the return of care.
Yeah. I think this is such a good thing. You're supporting the community, and it's a kind of giving back to the community, right? That is such a great cause. I would say that.
Mm-hmm.
There are so many questions coming to my mind, and let's start with technology and data, right? We have been seeing that technology has evolved a lot from last decade or so. So wondering what kind of exciting things are you doing within the organization, and being the chief operating officer within the organization, tell me a couple of things which has changed Herewith by implementing certain technologies.
I think that Herewith takes a data-first approach.
Yeah.
I think as a leader myself, my master's is a master's of science. And
Wow.
a part of that is within the healthcare space.
Mm-hmm.
You have to look at the data, because everything from something as simple as taking someone's blood pressure.
Right.
That's going to give you a certain amount of data over the lifespan of that patient, whether it's a good or bad blood pressure. The numbers don't lie.
Mm-hmm.
And I think it's also very important for, as we incorporate data, to know that sometimes you can have too much data.
Mm-hmm.
Well, I believe that that is where great leaders can really make a difference in saying, well, we have a lot of data and we have a lot of numbers, but now what do we do with it? And where Herewith really stands out is we've been able to take that data and really look at different areas within the nation. Where is our need the most? And where is it that we haven't approached? And I think that looking at the data, what we've just found is that we are needed in so many other facets in the way in which we do our business.
Right.
We are needed in dialysis. That's one of the new arms that we've extended out because care partners, after they've been a care partner for someone in dialysis, that skill really isn't given out to others. And they have such an amazing skill, much like homemakers. And we, you think of a homemaker as, oh, well, they stay at home, but really they're an accountant, they're a chef. And as a mother myself, I know that there is a long list of things that we do that aren't in the public eye. And so that is what are moving more into, is capturing the people who have these amazing skills, and they're bringing it to our app for others to utilize. And we got there by looking at the data of where we were needed and, what made the most sense for us.
Right. Very well said. And I think this is commonly across all the industries, the data plays such an important role, right? Looking into the data, you can predict what is going to happen next if the data is good and if the data is not corrupted, I would say that. So I'm pretty sure you have good data, great data. You have been working amazing in data management stuff as well, and that's how you are able to analyze the data for the future trends. So going back, I would like to also understand that what are the services being provided by Herewith. So one of the services you have told that dialysis, right? And is it already started or it's going to be the upcoming one in future?
So we've already jumped into it, but again, we're piloting it. Yes. So it's rolling out. We do have more care providers than clients on that side, but we have been able to partner with some amazing places so far. We do everything from, I always say, anything that your loved one at home would do for you, we can do for you because we're here with you. Yeah.
The name says it all.
Exactly. Yes, it does. And so we do. If every Wednesday night your mother likes to go to bingo and you just can't pull away every Wednesday to take her, well, you can just go on the app and you can look for someone for Wednesday to take her to bingo. And one of the most amazing things is you can look at who the person is, and for better or worse, as a society, we like the visual aspect. And so you can go on there and you can say like, oh, this person looks like they would fit amazingly well to take my mom to bingo.
Oh, wow. That's the flexibility you are providing even to the people. That's really good. So you have mentioned that you have to get connected to the different partners, right? So I believe that there are a lot of stakeholders involved, right, in this. So as a leader in the organization, how do you make sure the coordination between different stakeholders is being done properly, and how you map it? Do you have any framework or any model which supports it? Because you might be having multiple services, right? You have services like Companionship, you have services like Dialysis, you have many other services, and many other stakeholders will be involved in this case. So tell me more about how you map all the stakeholders and how you manage them.
Sure. So I will say, one, I have an amazing team. I will say that, a leader is only as good and as strong as their team. And they play such a big role. And as a leader, you have to define things in a way that others can understand.
Yeah.
And so if I come up with this big, shiny, fancy idea and I, put it out to the world, but nobody understands it, you have to be able to take that internal look and say, well, what could I do better? How can I communicate this better? How can this work more for the people? Because as a leader, as a good leader, it should be people first. And so I never want to forget sight of that. And that goes into the way in which we do our framework. So we are partnered with Salesforce, and that captures a lot of our data. That really does help. It touches everything from our internal workings to our customer workings. And of course, we are partnered with TechFocus, which it has been really a godsend for our company. And so I want to say that that those are the partners that we rely on for our internal workings. And that always goes out to our external partners because they are, anything that we do internally goes out into the outside. And if it is any form of dysfunction on the inside, our customers are going to know. And so we have to make sure that's very good. The way in which we do which next partnerships externally we will pick is that when I came into the company as COO in December of 2024, we sat down and we essentially came up with guides. And I said, here's these verticals. What do the verticals look like? Can they be well defined? And if someone comes in and says, we want to do this partnership, we then take a look at these guides because it's almost like a dictionary. All your definitions are there. Everything in which we can touch is there. And if it doesn't fit into one of the 5 verticals, we'll have to pass for now. And maybe in the future we can bring it on, but we really want to get our foundation to be very strong. Yep, strong foundation, I think, and then you can sky's the limit. Yeah, but you have to have a rock solid foundation.
Right. Very well said. I think there are a couple of points which are, hitting my mind and would like to repeat. So you mentioned that a good leader is the one who thinks about people first. Right. And especially in the sector like Herewith, where you have to deal with people and it's such a noble cause. You are giving back to the society. So when we talk about people first, you have caregivers, or helpers, and you have care seekers as well. Right. So what kind of framework you are following, which are more oriented toward people first and not that oriented towards process first? I mean, process is also important. That will lead to people, but then more focus is on people, right? So do you have any framework which defines such kind of processes?
We do. So, and more in the layman's term of it is that the storyline is we have Dan, who is our head of design, and I can't speak enough to how amazing his work is. And really, when you get that creative juices flowing, you can come up with some amazing product, some amazing frameworks for, or wireframes, I should say. And I'm not in the creative space. I look at things and think, oh, that's beautiful. But I'm very data-driven, numbers-driven, and kind of that hands-on person. And our company and our team takes such a people first. It's not just something we say. It is actually something we live by. Because then we have to take, the big design and the big creative, and we take it down to, can people use it? And when we're discussing people, it's our seniors. Can our seniors understand and utilize it? Can our loved ones, our mom and our dad, can they utilize it with ease? And so sometimes we have to put the creativity to the side and really change it, change the way in which we view the world, and really sit in the seat of that 60 or 70 or 80-year-old and think, what frustrates me? And how can we be people first? And that's what we challenge ourselves with daily, is really thinking from the customer side, really thinking from the seeker side, and not just keeping in mind that they're of an advanced age, but they could be in pain. They could be struggling. They could be frustrated when technology doesn't work. And I think of, I won't age myself, but I have a 20-year-old son and a 21-year-old son. I do.
Oh my God.
And I get frustrated with the remote. Thank you.
That's unbelievable.
I appreciate that.
Oh my God.
I'm in the technology sector myself, and I, like I say, I've got several degrees, and I look at the remote and I'm like, can someone just come do this for me? And that's at my age. And so I think, how frustrating must it be for them to, not understand how to just seek care?
Exactly.
And so I think that really having that people first mindset for our team is important. And then it's on my shoulders to make sure I have the people first mindset for my team. And so, that we work off of.
That's again very amazing. And, Yeah, very, very well said that people first mindset should come from each one.
Yeah.
Right? It's not only one person's responsibility. It's like how we have given the example that do something which your parents or your grandparents will happy to adapt.
Yeah.
Right. So moving on to another question, which is related to the same thing, people first adaption. So do you have simplified format of apps or design? How do you think the elderly person can really go ahead and seek for or request for any helper? What is the way, if suppose my relative or any senior I know, if I have to recommend Herewith, what is the process they should go ahead with? Do they need to download the app, or they can just go in the web and fill the form, or how simple it is?
Yeah, so thank you, Jas. It's actually we do our best to make it as simple as possible. See, that is business list. People first, exactly. And to make it as available as possible.
Yeah.
And so you can go on the web and you can just go to www.herewith.com.
Yeah.
You can Google herewith.com to find it even quicker. And you can go on iOS, which is if you have an Apple phone, and that's that people first, because what's iOS? Yeah, if right. And so you can go on your app store, and if you have an Apple phone, that's considered an iOS app, and you can download Herewith from there. And there is a helper app for the people who are looking for work.
Oh,
and
great.
so there
you have both the areas, both the sectors.
Yeah. And then we have on the Android side, if you have, a Google phone, you can go into that store and you can download the Android app or either one, helper or caregiver. The really revolutionary thing too that we're working on is now it doesn't have to be the care person who is looking for care. It doesn't have to be the customer. If you're sitting here in San Francisco and your mom is in New Jersey, you can go on the app and you can sign up for her, but you can have a caregiver go to her in New Jersey. So you have total and full control as to who's going to be there. And one of the biggest things is, just like my employees entrust me with their well-being and their careers and their futures, I also hold it upon our shoulders for Herewith that you're entrusting me with the care of your loved one. And so we make sure that our helpers are vetted. We use a third-party partner who is Checker. We do a nationwide check, a statewide check, and a county check.
Very, very important.
Yes. So only the people who pass those background checks are able to be chosen on the site. So that's obviously very important. And then we also hold the workers' comp and liability insurance for anybody who is working on the Herewith app. And that's an assurity for the families, because if someone, goodness forbid that they go to a home and they hurt their back. And now, who's going to be the person that pays for that?
Right.
And we don't want a grandmother or a grandfather or your aunt or uncle to have to pay for that out of their homeowner's insurance. So we hold the liability and they can utilize the workers' comp to go get the care they need. Also, that protects the helper.
Yeah. That's really great, because Herewith is following all the compliance, all the regulations, and making life much, much easier for the seniors and for the helpers as well, those who are, looking for a job and are really fit in for that specific area. So I completely missed your point on tech focus. Thank you so much for your kind words, because it just recalled. Yeah, thank you so much. And I'm pretty sure my team would be really happy to get the feedback live from the show.
We are super grateful, really, really, it's been an amazing collaboration. And, with the history of Herewith, we are a company who has been around for 6 years. And I feel like this is definitely 2025 is going to be our year for change and for growth and success. And so you guys being a part of this, Tech Focus being a part of this, it's an amazing partnership.
Thank you so much. And likewise, it is so good to work with any customer and help, customer with such great vision like yours. So really appreciate the partnership. Veronica, I would also like to understand from you that how is Herewith following up on the personalized needs from the care seekers?
Yeah, no, thanks for that question, Jas. So the way in which the app works, you can go in there And if I dare say, it is much like a dating app. And you get to choose who you want to come in your home. But not only that, you get to choose what skills they bring. And you can post whatever you would like. If you would like someone who can do the light housekeeping in the home, cook a meal, and offer companionship, that's perfectly fine. And so someone who can come in and really attend to all the needs is really important because, of course, you can hire just a housekeeper who comes in and, there's that old adage of cleaning for the housekeeper because you got to put all your stuff away first.
Yeah, that is a big challenge. Like,
it really is.
the cleaner who comes, we have to clean first layer and the other cleaner comes.
Exactly.
The second layer.
They do. And so we've taken away that. We've taken the burden off. There's a mental load and then there's the actual physical load. We have taken that burden, hopefully, from not only the actual person receiving care, but the person who is scheduling that care, whether it be the loved one who is getting care for the other loved one. We're hoping to shift that burden away. And I think that's very important to look at and remember is that person is, you're welcoming them into your home. Hopefully they become a friend along with your worker and your helper. And that's why we call them helpers, because we don't want them to be, they're here to do a task. They're here to complete lots of tasks for you, from housekeeping to cooking, companionship, transportation to your doctor's office. And I think one of the scariest things sometimes for seniors is if they take, a transport service, they get dropped off at the doctor's office and then they get picked back up. But what happens in the middle of that doctor's office is so important. Whatever it is that needs to be captured, and who captures that if you're not available to go with your loved one? And so our helper will be there from drop off, all the things that happen in the middle, to pick up, to going back home.
Wow.
And that's very important. And it just gives a safety and security to the families and to the person receiving care.
So it's like end-to-end service being provided, and it is not something like one plan fits all, right? So it is completely personalized based on what seniors are requesting for. So I'm very curious to know, are you also expanding beyond seniors? What if adults who want to have services like that, like how you mentioned helpers, right? Or the cleaners. So to reduce adults' task, are you thinking to have the services beyond just seniors and to go towards adults or towards, kids, children?
For now, we are going to focus on adults. Our main focus and our original, if you will say our original business was seniors, and we will always remain in tune with seniors. We will move into the adult side because as we do dialysis and we look into that is a much bigger, there's 8.
There isn't any age
exactly
in that.
So anything in the adult sector that needs to be had there. Now, we have been approached at the ADC, which is the annual dialysis conference, to look at the pediatric side for dialysis. We will take a look and see how we can help. And what we really would still focus on is respite. Because as a child who is in need of dialysis, they most likely have a loving adult that is helping them. We want to care for that adult. We want to offer respite to that person so they don't get burnt out. So they can take an hour, 2 hours, or 3 hours of time away from home for themselves and to really then come back refreshed and ready to do the challenge again. And so we still will want to focus on that adult partnership and that adult person that needs help. But I don't believe that we'll always just do the senior care, much like dialysis is opened up, but it will be, I would say, will always be a priority.
Thank you so much, Veronica, for your all insights and your information. Last question regarding the future, right? Where do you see Herewith in coming years?
Oh, that's a great question. Like I said, I feel 2025 is definitely a year for growth and success, and for the future is, we're super thankful for our investors, VIG. I mean, they've been phenomenal in allowing this to grow, and they know, like we know, that this service is needed. It is a needed service, and I feel as we launch more and more of our intricate partnerships, we're just tapping into hospice. We're also doing the dementia
Yeah.
And then in different states, we had a request in California to do the California providers.
Mm-hmm.
And as those new adventures come about, I just see nothing but growth. I see growth both for us as a team, us as a company, and then for the seniors, because we will, there might be something out there that someone is thinking, oh gosh, Herewith would be really good for this, that we haven't even tapped into yet. And one of the things that we want to do is more of always remaining with our in-home, non-medical care, but specialized. And one of the things we, up and coming, I think would be doulas, because there's such a movement in the US to have families stay home while they're birthing their children.
Yeah.
And I think that Herewith will continue to grow to match people where they are at home with those care needs that they're needing, but not necessarily always in the senior space. And so I think that is how we'll grow.
Yeah.
That's what I foresee for the future, is just more of that specialized growth.
Yeah. I think that is really important. Thank you so much for coming onto the show.
Yes, thank you for having me. I appreciate it.
Absolutely.